Hey guys, my name is Dr. Nate Wood. I'm a resident physician in primary care internal medicine, currently working at Yale New Haven Hospital on one of the newly created COVID floors. So it's about 7 p.m., just headed into work, and thought I'd show you guys what a typical work night looks like for me right now. Be taking care of around a dozen patients tonight who have COVID. So I've gotten the dish on those patients and I'm all up to date. We wear surgical masks all day throughout the hospital and especially here on the COVID floors, except for when we're seeing patients one-on-one who have COVID, in which case I'll take this mask off and put on one of those fancy N95 masks. Right outside each of the workrooms, there's like a little PPE cart where we keep everything that we need. So for this shift, I'm going to need a hair bouffant. Take one of those. I'm gonna need a face shield. We get one of these every shift, wipe it down, keep it clean. This all gets recycled and turned in afterwards. Here's our stash of N95s. Luckily I'm the standard 1860 size. So I grab one of those and then we'll change out the surgical masks once per shift. So I'll grab another one of these also. It's about 11 o'clock. I've been here for about 4 hours just taking care of the patients who were already on the floor with COVID, and my first patient from the emergency room, my first new patient I should say, just arrived, and so I'm gonna quickly admit her, go and chat with her, and so that means I need to get all geared up and ready to go. All right. Our lady is admitted, she's doing well. All the rest of the patients seem to be tucked in for the night, pretty stable, so I'm gonna keep an eye on them, and if the nurses need to contact me, they can always reach me on my work phone here, but I'm gonna try to head to the call room and get a little shut-eye if I'm lucky. Fingers crossed. I've never seen anything like this before. This is my first year being a doctor. And so I was prepared to see the routine things like COPD, and asthma, infections, diabetes, high blood pressure, stuff like that. And you learn about how to deal with those things in medical school. Something I was not taught to deal with is a global pandemic of a novel virus never before seen in mankind with no known treatments. And things change on the fly so quickly every day. Something I'm seeing talked more and more about in the media, as well as at the water cooler with fellow healthcare professionals, is how are we going to take care of ourselves during this pandemic? For me, that involves a lot of music. Hopefully you guys have enjoyed seeing what a typical night in the life looks like for me. And what I'm hoping people can really take away from this is that, healthcare workers, we're coming to work every day and putting ourselves at risk of getting this really, really dangerous virus. But it's what we're called to do, and I'm happy, honored to do it. Sometimes in our lives, we all have pain, we all have sorrow, but if we are honest, we know that there's always tomorrow. Lean on me when you're not strong, and I'll be your friend. I'll help you carry on, for it won't be long till I'm gonna need somebody to lean on. For it won't be long till I'm gonna need somebody to lean on. Be safe, guys.